You are listening to Vital 100, the podcast designed to take your health to the next level.
Hello, this is Dr. Bob Johnson. Welcome to Vital 100 podcast. Most people feel that their dental health has nothing to do with their overall health. Well, this podcast is going to disprove that and tell you why the best healers and doctors in the world consider your dental health as absolutely critical to regaining overall health. So let's talk a little bit about the different structures of the oral cavity. We have obviously the lips, we have the gums, the teeth, which everybody knows about. We have the tongue, and that goes back into the throat. Well, each of these is very important in determining overall health. So first of all, let's talk a little bit about prevention. Prevention is very, very important in terms of making sure that you have good gum health, good teeth health, and that disease and infection is not going to affect the rest of the body. Let's talk a little bit about restorations of teeth involve materials that are not natural materials. Everything from gold to silver fillings to now resins and porcelains are very important to restore tooth structure that's lost due to decay or trauma. And up until, probably 10 years ago, it was thought that the silver fillings, which contained mercury, were fine. But now we realize that these silver fillings, which is really a misnomer, contain 50% mercury, and it escapes. And mercury is one of the most dangerous products in the entire earth, and so that this escaping mercury affects so much of the body, everything from the brain down to the kidneys and down to the liver and the toes. And so it's important to understand that the type of material is going to be very important with overall health. And so now we are using things like porcelain and resins, which do not contain unhealthy materials. And in fact, they look a lot better than the dark mercury fillings that were used with great consistency up till about 10 or 15 years ago. It's important to realize that if someone decides to take out their mercury fillings due to the mercury content, then a biologic dentist who understands how to minimize the mercury exposure is going to be very important. So dental materials is one way that affects the rest of the body. The escaping mercury and or toxic materials of some fillings will get into the bloodstream and be circulated throughout the body. Then the other material, which most people feel is fine, but which creates some problems, is that of fluoride. Fluoride came about to be preventive in tooth decay. We now realize that fluoride has minimal effects on the decay process and that fluoride does pose some problems. Now, we do use fluoride in very highly cavity-prone people, but for the most part, fluoride is not what it's been made out to be. In fact, I tell people to avoid it in their toothpaste and don't get fluoride treatments. One of the things that fluoride does is fluoride escapes from the mouth, and when it goes into the thyroid, which is in the neck, what happens with the fluoride is it displaces the most important nutrient that thyroid uses, which is iodine. And it can cause or be the underlying cause for a lot of thyroid dysfunction. So fluoride is something that I think is overrated as far as its positive effects, and we now know that fluoride can cause other health challenges. The next thing is that of infections. A lot of people understand now that gum infection is very important, and if you've got an infection of the gums, one is it affects the gums themselves, but also the underlying bone, and so keeping infection-free of the gums is very important, not only by your own oral hygiene, but with a hygienist, because that infection will spread throughout the body, and we now know that the infection in gums does negatively impact the heart, it negatively impacts the liver, and it does get into the sinuses in the brain and create some problems there as well. The other area that infections can affect in root canals. Root canals are an attempt to save a tooth in the mouth by taking out an infected or damaged nerve and then filling the tooth with a material that supposedly doesn't interact with anything. The problem with root canals is that the walls of a tooth still house that infection even though that central canal has been filled. And so that infection in the walls of the tooth can spread throughout the bodies and create some other health issues associated with root canals. We're now working on ways to mitigate or to minimize the infection in the walls of the tooth, especially with concentrated oxygen, those kind of things, because those bacteria, those microorganisms, do not like oxygen. They're what we call anaerobic and can be killed with oxygen prior to filling a root canal. The other place that infections and toxins can reside is in old extraction sockets, especially the third molars or the wisdom teeth. These are what we call cavitations, and if it's not removed correctly, the tooth, then the bone may not form very well and can be a little source of infection and or toxicity to the body. Again, these are called cavitations, or we also call them NICOs, N-I-C-O, which stands for necrotizing inducing cavitational osteonecrosis, a very big term. Anyways, the infection, both of the gums, potentially in root canals, and in cavitations, can get throughout the body and create some major issues. The other area that infections can have a profound effect on overall health, which is at the edge of the dental area, is that of infected tonsils. Tonsils are lymphatic tissue where the lymph is filtering out toxins and infections and bringing white blood cells or the immune system to areas of the body. And the tonsil is the chief filter station for the lymphatics. And so when these toxins or the infections are brought to the tonsils and they filter them out, the tonsils can get infected and spread that throughout the body. So very important to not have infected, toxic tonsils as well. The other area that's important with respect to dental health is the bite. We call that in dentistry, we call that the occlusion. The occlusion is important because if it's not hitting correctly, if the top teeth and the bottom teeth are not hitting correctly or one side's hitting before another, then what happens is that the jaw position is profoundly affected, and it affects the alignment of the upper and lower jaw and the cranium and the vertebral column. And so that the occlusion or the bite, which can be off, can have some profound effects on the overall alignment of the body, the spine, the way the hips are. And so it's important to make sure that the alignment of the teeth and the jaws is not throwing off the alignment of the rest of the body. So this involves aligning the temporomandibular joint where the lower jaw meets the skull. It also involves orthodontic treatment, so that orthodontic treatment is not just making the teeth look pretty and aligned, but also to make sure that the bite is correct after orthodontic treatment is finished. So that is really the overall effect of dentistry on overall health. How is it that the dentistry does affect the health? Well, if you understand that the mouth is very close to things like the brain, to the thyroid, down into the circulatory system and the lymph system, and can realize that what goes on in the mouth has a profound effect on the overall health. One final thing, and that this is something that a lot of people in Western medicine don't understand, and that is that every tooth is on a acupuncture meridian or an energy meridian or a electrical circuit, and that when the teeth are infected or when they're damaged or out of alignment, what can happen is that whole energy circuit that is attached to the teeth and other organs can be negatively affected. And so we have to look at not only how teeth are affecting the overall health of the mouth, but how it affects the overall health of the body. And so this is very important in understanding how to treat people, and that's where a biologic dentist comes into play. So I hope this is informative, and if you want more information about dental health and overall health, please visit our website at vital100wellness.com. Again, take care. This is Dr. Bob Johnson, and I hope you enjoy the journey.
Thank you for joining us on this episode of Vital 100. Check out our website at vital100wellness.com for more episodes, blogs, supplements, and more. If you have questions for Dr. Bob, or if you have feedback or recommendations for the podcast, please send an email to info@vital100wellness.com.